The condition I chose is HIV, human immunodeficiency virus. This virus attacks our body's immune system. If the virus is left untreated, it turns into AIDS, affecting us at the organ level. Although HIV does not affect our organs, it affects us at the cellular tissue level, causing symptoms such as fevers, rash, and flu-like symptoms. It kills our immune system, making it hard for us to fight off other illnesses. HIV is transmitted through blood, semen, vaginal fluid, breast milk, and needle sharing via the mucosal tissues of our body, which is the main portal of entry. The mucosal tissues are where majority of our lymphocytes and CD4 T cells are stored. HIV attacks our CD4 T cells, our helper T cells, which are white blood cells. Once this happens, we have a hard time fighting off diseases or illnesses or infections. The reason is because HIV uses CD4 cells to replicate itself, causing the cells to burst and be destroyed. Once the CD4 T cells count drops below 200, the virus then progresses into AIDS. HIV is referred to as a retrovirus because it works in a back-to-front way, unlike other viruses. Retroviruses store the genetic information using RNA instead of DNA, meaning they need to make DNA when they enter a human cell in order to make new copies of themselves. HIV is a spherical virus. The outer shell of the virus is called the envelope, and this is covered in spikes of glycoproteins which allow HIV to lock onto the CD4 receptors on CD4 T cells and enter the cell. The capsid contains two enzymes essential for HIV replication, that is, the reverse transcriptase and integrase molecules. It also contains two strands of RNA, which holds HIV's genetic material. HIV affects people emotionally, mentally, and physically. People who have been diagnosed with HIV don't have the proper support system sometimes, which can then lead to depression and anxiety and other mental and physical issues. Unfortunately, there are many treatments and therapies for people with HIV. There's a lot of treatments with medications that are available to help the replication and destruction of our T cells. Many people who treat the HIV virus as soon as they find out they have it often live a normal life without any symptoms. So they are asymptomatic, and you could be asymptomatic forever if you're being treated. There's also there's recent scientific advances that have demonstrated that early initiation of treatment, such as the anti-retroviral therapy called ART, not only preserves the health of people living with HIV, but it also reduces their risk of transmitting HIV to others by 93.3%. Stats show that there are certain groups that are at higher risk, such as the gay community, transgender, and drug abusers. Also, they're stating African Americans and Hispanics among ethnicity have a higher rate of having HIV. Of course, homelessness and less advantaged don't have higher cure rates because they don't have access to healthcare. The healthcare system as other people, such as they can't afford treatment, they can't afford the medications. They don't even know where to start. Some of them don't know about the free clinics or about the free testing centers. Some don't even know that they have HIV, not just homelessness, but a lot of people. Some people just don't ever get tested for it. Therefore, they're transmitting it to other people via sex or drugs, needle sharing. I will go ahead and attach some statistical information. Thank you.